Everybody, my name is Natalie Eden. I'm the CEO and co-founder with Impetus Digital. At Impetus Digital, we have built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools. We have worked with life science companies from across the globe over the past 13 years to help them with everything from virtual advisory boards, digital investigator meetings, online medical education. And since the launch of our award-winning Insight Events platform, we've also been helping pharma companies with their MSL and Salesforce training, large corporate events, innovation hackathons, and everything in between. But more importantly at Impetus, everything we believe starts with a conversation. And from these big, hairy, audacious conversations with some of the leading edge thinkers, the digital provocateurs, and the healthcare thought leaders, we can all work to collectively and positively disrupt healthcare. So I'm really excited to having one of these thought leaders at the table with me today. And this is actually Hector Bremner. After a very successful career in business development and operations management with some of Canada's largest brands, Hector Bremner founded Vancouver-based Touch Marketing in 2007. Here he earned a very strong reputation for delivering results. This drew the attention of leading businesses and nonprofit organizations looking for winning strategies in order for them to communicate their messages and to achieve their goals, and ultimately brought him to the world of provincial politics. He was invited to join the BC government, so British Columbia government, in 2013. Here he served as a key advisor in the office of BC's Minister of International Trade, the Minister of Tourism and Small Business, as well as the Ministry of Natural Gas Development and Deputy Premier. In 2017, Hector was elected to Vancouver City Council in a by-election. Today, Hector is CEO and board member of Avricore Health Incorporated. This is a pharmacy service innovator which is focused on acquiring and developing early-stage technologies aimed at moving pharmacy forward. Through its flagship offering, Health Tab, its mission is to make actionable health information more accessible to everyone by creating the world's largest network of rapid testing devices in community pharmacies. Welcome, Hector. So happy to have you on the show.
Well, thank you, Natalie. It's really great to be here.
So Hector, very exciting. I think a lot of people are excited about not only that you started off as an entrepreneur with your own company, with Touch Marketing, but then you decided to go on the opposite side and go into politics and then come back and do this again. I think all of us would be very interested to understand a little bit this very interesting career trajectory and how you landed in the place that you are today.
Yeah, it is. I've seen it all from all angles, that's for sure. And, you know, when you go, you know, from private sector to government and vice versa, you know, one camp will always feel like you're going from the dark side or to the light side. It just really depends on perspective. But, you know, having been a private sector person and, you know, working within the corporate structure, then being an entrepreneur, you know, and having the marketing company was really interesting because I got to work with such a wide facet of folks. And in that, you know, you started coming across a lot more political folks. And, you know, I started to realize that, you know, you can sell things or you can really be involved in pushing ideas. And, you know, I became less and less interested in, and I was very good at it. And, you know, I could make a lot of money at it as selling things, but it just wasn't getting me out of bed in the morning anymore. It wasn't a challenge. And I think that being able to shift the dial and sell important concepts became a lot more interesting for me. So that started in sort of the nonprofit sector, but then, you know, the opportunity to work in government, it was really, you know, it was a haircut, you know, financially to do it. It's not like, you know, you make a lot of money working in government, but I felt like it was just this once in a lifetime opportunity. And I really took it as kind of like a going back to school kind of thing, and seeing, you know, so many of us, we watch and we consume politics, and, you know, most people think that they have a pretty high functioning understanding of it. I tell you, until you've worked inside of government, you have no idea how it actually works. So it always seems so easy from the outside. And I was less interested in easy, and I was more interested in what was going to be impactful. And I got a chance to work for the Minister of International Trade for British Columbia, and got to see some amazing things and learn an incredible amount about various sectors within our economy. And then I was brought into the deputy premier's office, and that was a whole other universe when we were establishing a new sector of liquefied natural gas development in British Columbia. And also, oddly enough, had the housing file, which is a whole other thing, which became a passion for me. And then when I left government, I was the vice president of a well-known communications firm out here, and I was advising industry and government and pushing on public affairs matters. And then out of nowhere, I ended up it was a long story short, as I ended up getting elected to Vancouver City Hall, which is like a whole other long story. But that being the actual stakeholder or being the actual decision maker and an elected official as a whole, it really puts matters into a different perspective. And so all of this is to say that when we bring this sort of mentality into business, is to say that, when I'm voting for something, that it has a real life impact on me, and I have to stand by what I'm doing. Right. And so often in business, what I found was demotivating was that people are not standing behind really what they're doing. It was sort of like they're in, they're out, they're not really committed to what they're doing. But I got asked to get involved with this organization, and originally it was sort of just providing advice. But next thing I know, I'm running the company. But Health Tab in particular was something that I really felt the team was deeply committed to. The individual that created the technology, Roger Seckham, is our CTO and remains the president of Health Tab today. And I think we all shared a vision, which was, in a public policy matter, really touched me when that was the idea of getting away from the concept of healthcare budgets as simply as a matter of cut and spend, but really working towards early detection, screening, prevention, and investing earlier in how do we move people away from acute care. So that's kind of how I landed where I'm at, and in the shortest possible way of explaining it. But I've found that there's been a common thread through it all, that the political work really does attach to Health Tab, because it is leading a very important conversation from a health policy point of view, and pushing the boundaries of where we need to go, and moving the conversation in what we feel is the correct direction.
So I love that, actually, Hector, and I completely agree that sometimes these disparate things lead us into a place of calling where we can then, assimilate all of these disparate pieces into something that is very unidirectional and has a lot of gravitas to it. So I'm really curious in the note around, I always like to understand what the problem statement is. So when Avricore Health, which is the makers of what we're talking about here, Health Tab, what were they trying to solve? What is ultimately, and I'm assuming, of course, that it started in British Columbia, or, it's obviously a Canadian product that's probably, moving outwards and globally, but what were they out to specifically solve? What was the problem statement?
Yeah, that's a really good question. So it's the challenge for the company at the time was originally, because it's a publicly traded entity, there was a board of directors and there was a group of individuals. It was a cross-licensed generic drug company. So it was importing generics and selling them in pharmacies. They had been doing it for close to 20 years. But for those following the drug world, they know that an extraordinary amount of pressure has been put on the cost of generics and IP and so on and so on, including pharmacists and pharmacies. Had their fee structure changed dramatically, including in 2015, where about $4 billion worth of revenue was taken out of the sector in Canada alone. And so there was some pharmacists on this board of directors and some people involved, and said, look, the future is not going to be cross-licensed generic drugs. The future is going to be service revenues in the pharmacy, because the pharmacy is having pressures to change. The drug sector was changing so rapidly on the profitability side. And then thirdly, there was the consumer itself. The consumers themselves are saying, well, how do we interface with healthcare today? And I think it's a big question for many people. And, we have in Canada, speaking in the Canadian context, while we technically have a universal healthcare system, you kind of have to use air quotes when you say that, because it's not really universal. I mean, anybody can access it, but that access is not universal. So where you live, your economic profile, your household income, gender, race, all of this comes into play as to how and what services you're able to really access and when and how. And so for most people, they want more control. They want information up front. They want agency, as it's called. But the healthcare system is not really built for that. It's much more of a removed system. You're much more of a passenger in your own healthcare, and that doesn't work for the consumer. So the consumer is turning to Dr. Google, which is a problem because people are now getting maybe wrong information or acting on information or not getting enough information. Sure, they're going and getting pharmacogenomics done through 23andMe and whatever, but that's telling you the odds. It's not really telling you where you're at today. And so the physician is saying, well, look, we get paid for one question in 15 minutes. This is kind of how this works. This is, and most people don't have a family doctor anymore. And so the patient is left in this troubling position. The pharmacy wants to fill that. They need new revenues, and so they can drive that on the service side, but they don't have the tools. And so the pain point really became putting those tools and using these technologies in the pharmacy setting and driving a patient experience that they're more in the driver's seat. They're using evidence-based care as the core driver of the conversation. And the pharmacist is able to fill this really important gap where you have now a true universal access to healthcare where anybody can walk into a pharmacy. Everybody has a pharmacy that's close to them. You can walk up to the counter and you can just ask your question and sit in this consultation room and take a test on a world-class laboratory grade machine, not typically found in pharmacy. Our technology will share that result with you in real time, meaning you being the patient, but it also interfaces with the physician, the pharmacist, and others to make sure that information gets to the players that need it in order to serve you better. So we're really trying to wrap a patient-driven experience that's truly equitable and democratizing real access to the type of preventative care and early detection and screening that is largely missing. It's usually reserved for a select group of people in our society today.
So very interesting. So what I'm hearing you say is Avricore used to be a product company, but
Right.
has since then pivoted based on the market dynamics into a service company, more specifically a data company or a data analytics company. In some ways, it kind of reminds me a little bit about the democratization of banking for the underserved. So you're now allowing the unserved, healthcare consumer that, or the unbankable who are now getting banks. And so now the healthcare consumer who didn't have a family doctor can now get healthcare. So the premise behind all of this, or the machine behind this new data service or data analytics, or a service company when it comes to data, is HealthTab. So can you tell us a little bit about what exactly is this software and how does it work?
Yeah, so it's a complete program for a turnkey solution for pharmacy to be able to offer diagnostics on site. So we partnered with Abbott. We offer a suite of instruments from them. These are instruments that would typically be found in an acute care setting, which would be like an emergency room, or in a hospital setting, or in certain laboratories. In the United States, point of care testing is a little bit more sophisticated or a little bit more advanced. I guess a GP's office may have these instruments, but not always. But what the challenge for Abbott was, and as we discovered in our discussions with them, was that the instrument produces a result, but at the end of the day, it produces just numbers. So you have to still do a series of calculations based on that individual's, again, age, sex, medication history, a few other pieces, in order to discover what is normal for that person, right? So unless you can do the Framingham risk score in your head, the reality is that this machine is producing numbers, but you still need to be able to interpret this result. So what we do is we plug into the machine and use an open API, a cloud-based solution that takes information that's collected in a survey up before the test is conducted in consultation with the pharmacist, and it merges that information with the test. And this all happens in real time once the test is conducted, which takes about 12 to 15 minutes, depending on the test. And then it produces a result that's immediately shared with the patient, where they can log in and they can see their results in a really consumer-friendly user experience. But our platform also allows, and this is really unique and nobody else is doing this, so we can connect to the electronic health record management systems that will be used in the pharmacy. So that means the patient, the program that the pharmacy is already using, they don't need another login, they don't need another interface. This is actually showing up in the patient record, which is important because they're using those systems usually to power other information and other tools. So we're now feeding them direct diagnostic information in real time to power their other digital tools. And further to that, we provide a platform whereby sponsors, so research entities that are looking to study patients, are able to now fund the platform where they are able to now drive testing programs that either support their products. Some products are sensitive to kidney function, for example. So they want to test to align with every new prescription and renewal because they want to make sure the efficacy is targeted. Through to patient acquisition, we're identifying a lot of folks that have undiagnosed kidney disease, liver disease, heart disease. And then how do you, engage in those patients in a meaningful way? So we're providing this platform. It's an open platform where research can be conducted. Obviously, new services can be offered within the pharmacy utilizing this. But the end result is that the patient is able to walk into a pharmacy. If they have a question about their health, they're able to get an evidence-based driven consultation with a healthcare professional. And then that is informing and driving the healthcare experience. So we simply provide the turnkey solution to do it. We don't have to manage the programs. That is for the healthcare practitioner, but we provide them the tool, the right tool, to finally execute on something that they've desired to do for many, many years. But the solutions to date have usually been siloed or incomplete or not meeting the sophistication level that they're looking for. But now with us, they're able to accomplish that.
So you were mentioning the partnership with Abbott. And so one thing that one immediately thinks about, it's probably the Abbott ID Now molecular PCR test, or what we're calling the rapid test associated with COVID-19. Has this really, so I'm just curious about Health Tab, your overall platform. How's the utilization of the platform, its significance, its importance, its usability, has it changed dramatically since the pandemic has transpired?
Yeah, virological testing is obviously something that was a whole new world for us, and we're very proud that globally we're the only healthcare technology company that has been able to distribute the ID Now. There's Walgreens has 6,000 of them. We have an objective to expand the network of ID Nows in pharmacy across Canada, the United States, and Europe. And what it means is that you'll be able to walk into a pharmacy over and above the diseases I just mentioned, which are endemic diseases. But you will actually also be able to walk into a pharmacy and rather than standing and sniffling and staring at the Sudafed or whatever in the aisle, you'll be able to take a test and understand, is this serious? Sort of, is this a SARS-CoV virus or variant, or is it influenza? It also tests for strep, which is a serious concern. Many of us here are of the Sesame Street generation, and Jim Henson, died of a strep infection, in his 40s. He was just, a hardworking guy, and he didn't want to go to the doctor, but a strep infection went too long. And this is actually a pretty common occurrence, even pre-COVID, is that, people will think that this flu, they'll let it go, the sick, you might be sick for a couple of days. But, if you're elderly or compromised immune, or there is a serious concern going forward, and I think patients are going to be very concerned about it. They're going to want to know if they have contracted something that is serious. And the pharmacy is the best place, again, to do this, the ID now is able to do these tests in just minutes. It's about 12 minutes to produce the result. It's a molecular result. It's very similar to PCR. It's a different form of PCR. It's called nucleic acid, but a thermonucleic acid test. But it is a fantastic piece of technology. And the way that we envision this is that both in pharmacies and including in resorts, that you'll be able to have testing on site. You'll be able to have that information go direct to your travel provider, and it'll integrate with those systems. And it'll be a much lower cost confirmed result. You're not waiting, days or weeks to get your PCR result. And it's more sophisticated, of course, than a rapid antigen test. That said, we have also modified, we've had to be flexible. We've also, we typically prefer to connect to an instrument, but we also have now the ability to track and trace the rapid antigen analog tests. So these are the tests that are not using an instrument, but you'll be able to log that information into our system and track and report that information in real time. So COVID definitely caused everybody to pivot and make changes. But however, despite all that, it still was diabetes. Irony of ironies, that has really been driving the business, and those underlying health concerns have really become forefront in people's minds. Is because if you really want to pandemic proof yourself, you need to make sure that your underlying health conditions are stabilized and managed well, because that's really functionally what gets people. There's many people watching here that I'm sure that will still say that, COVID's the flu, or COVID's not that big a deal. Maybe, but that's the problem, is if you don't know that you have underlying health risks, COVID can get real serious real fast, and viral pneumonias or even strep infections. And so, but the reality is that COVID is dumped gasoline on the baked in trend that was already well established prior, that the pharmacy's practice is rapidly evolving, and it's definitely going to get more into services, and that rapid testing and testing on demand is something that the consuming public and the healthcare consuming public is going to be a lot more interested in. I remember in the midst of the pandemic, hearing people picking up their coffee and talking about comorbidities. Not a lot of people talked about comorbidities prior to the pandemic, but I think it's caused everybody to reflect and think a little bit more about, what can you do to make sure that you're proactive about your health. And that's, it can be diet driven, it can be going out for a walk, but at the end of the day, taking a test and understanding where you're at, and working with a healthcare practitioner to get on a plan is the best way if you want not only more years, but it's not about living longer. It's about how good are those years, right? So, there's, and I've already lost both my parents, and I shouldn't have, I don't think, because I think they both ended up suffering from endemic diseases, and just the old attitudes of really not wanting to make changes, or not having the information or being guided through a process to make changes. And I think that it is really critical, if you also care about, back to politics for 1 second, I'll close my thought, is that if you do care about public spending and you do want to see your tax dollars go further, you have to remember that we're getting north of 50% of every dollar that government takes in is spent on healthcare. Then you factor in education on provincial budgets. If you factor in healthcare spending and education, you're at 70% of every dollar. So now you're left with an extraordinarily small amount of money for the infrastructure that you want and all the other, public safety, whatever it is that you want to do, social programs. You want people obviously not sleeping on the streets. How do we fund those programs when we are investing in acute care, when we're not currently investing enough in preventative care? And that's really the big job ahead of us.
So one of the things I think is really important in here is a premise around the change of scope. So as we know, traditionally patients have gone to physicians or their healthcare provider, and there's kind of been a certain framework, if you will, at which to get your healthcare. COVID-19 has changed all of that. We've now suddenly seen a resurgence of nurse care, practitioners, PWG, public support workers and other sorts of things to sort of spread this out and, as you call it, democratize healthcare giving.
Mm-hmm. Mm-hmm.
Now we've also seen recent legislation changes in the scope of work of pharmacists. People have not routinely ever considered a pharmacist somebody they would go to for healthcare. Why does this make sense now? What is the scope of practice change for pharmacists? And how are they now equipped for somebody like myself, just an average person going out, can feel confident that these people are going to give you the right level of care?
Speaking of healthcare, so I live close to a hospital, so you may hear ambulances or fire trucks going by me. So there's one going by now, so hopefully it's not too loud. But the question is really profound because pharmacists are in an interesting position today. So they can inject you with a vaccine, but in some provinces, they can't prick your finger for 10 microliters of blood. So it is these incongruencies in the policy as to who can conduct what tests and sort of the fences and the arbitrary nature of health regulations, particularly at a provincial level. However, the federal government can inform a great deal of this. So the push on the scope of practices is to allow the pharmacists to be able to take some of the pressure off GPs. So Alberta is a good example. They have the most expanded scope of practice in the province. They can do lab requisitions in that province, and they can also do certain prescription renewals. So that's a pretty profound amount of work that gets taken off now the schedule load of the GP. So that's really great. We think that needs to go a little bit further, and is already kind of happening in an organic way. So for example, a pharmacist in most provinces today can do what they call a pharmaceutical recommendation. So it's essentially like a way of doing a prescription. So they issue a pharmaceutical recommendation to a physician that they're working closely with, and then that physician essentially accepts that recommendation based on some information, and then will then issue the prescription without seeing the patient. With diagnostics, you can now do that in a safer and a more evidence-based way, because now the physician can see real diagnostics on the patient and go, yes, like I'll give you a quick example. So we found, for example, an individual that had already been diagnosed with diabetes, zero follow-up from a physician, no further testing. This individual is deeply symptomatic in their diabetes and needed service quite badly. The pharmacist was able to do the consultation, give the test, show the collaborating physician this information. That physician was then able to prescribe that individual insulin. And so they were all able to do that in one shot. So now this individual is managed and they're going through a continuum of care, including dietary support. And so now this individual is managed, whereas he was deeply symptomatic. He was dying and he was very, very sick, and he was not accessing healthcare the way that he needed to. So the pharmacist can be, for the most common issues, a fantastic window and a conduit to take pressure, to be that front line, like you mentioned, nurse practitioner, to be that sort of filter a little bit. That you have to remember that a pharmacist doesn't just go to school to how to count pills. They are med students. They go to medical school. They just divert out of certain courses and they divert into the drugs. They understand the drugs better than anybody else. They understand the medication. And when we're talking about the long-term management of a patient, the pharmacist needs to be able to do more of that work. So the big asks right now are standardization around the rules nationally around point of care testing. Who can do it? Particularly the pharmacist should be able to do that. The pharmacist needs to be able to do more in terms of prescription renewals, certain prescription renewals, and certain services and consultations that need to be funded by government. And so really critically, in June of this year, Bill C-237 passed, and that has now triggered today. Cabinet was sworn in, but this the clock is now ticking as of today that the new Minister of Health, Minister Duclos, has 12 months to consult with stakeholders and Canadians and come back with a national strategy for diabetes management in 12 months. So in October 2022, and from now until October 22, there's going to be a great deal of work being done by various stakeholders to make sure that certain reimbursements are, and more standardization and more clarity around the role of pharmacists, and more early prevention, detection, and screening work offered.
Absolutely makes sense. So we're talking about, this really neat new platform. There's online surveys that people are waiting for their medication pickup or just walking around the aisle. So they're going to be consenting to getting these surveys done. And this is all getting amalgamated into this smart tab sort of portal that can then, it's interoperable with electronic health records and other systems. Tell us a little bit about the major concerns that people are having with a couple of things. One, privacy and security of their data. Who is actually using it and what's being done with it. And the second piece is, since again, COVID, there's been a lot of conspiracy theories about everything you can imagine, but there's also these concern about, and again, the issues that we've seen with Theranos and Elizabeth Holmes and sort of the all-knowing tricorder diagnostic. Are people distrustful of this, of the testing, and really of the whole system? Tell us a little bit about how you work around some of these concerns and issues.
Well, I'll start with the second question first. So I think that, the challenge in Theranos is a good example that on one side, it's why we're not in the device business, and it's why we don't want to be in that space ourselves, because it's to try to get something actually executed and to get it approved and all the rest of it is deeply problematic, even if you're not lying like she was. So the reality, but however, the positive thing that we normally take from the Theranos experience is that they proved that there was a market. They proved that the consumer was there for it, that the major pharmacy groups knew that this was the direction that we needed to go. And that was offering more services in the pharmacy. So from that side, I think the consumer, for the most part, we don't get a lot of questions around the efficacy of the machines because we're partnered with, such a top tier manufacturer like Abbott. We also work with another California-based company called Abaxis to offer another instrument. We have the world's leading brands now asking us to also add their machines to our mix, but we purposely try to de-risk that side of it by working with established, generally accepted, highly successful instruments. What's unique about what we're doing from that side of things is it's not a tricorder so much. The instruments they do what they do. And to do the full testing menu that we offer 3 to 4 machines that do it, and we're really clear about that. But the future will evolve, and we remain agnostic. And as technology evolves, we'll be working with those instrument manufacturers and those new tests to pioneer them and integrate them into our platform. But I think in terms of people's distrust or concern is, I think that it's more about the fact that currently when they engage with healthcare, they go in, they see a physician, they listen to your chest with a stethoscope, and they tell you you're fine. And that anxiety level is what's driving people nuts, because then they've already been on the internet and they've already convinced themselves that they have, I don't know, like Lou Gehrig's disease or whatever it is that they read about, right? So now they're so we're actually tamping down a lot of that concern and saying, like, look, someone might freak out and think that they have COVID. It's like, no, you can take a test. It's like, it's the flu. It's fine. Here, or you don't, most importantly, you don't need antibiotics. The overuse of antibiotics is deeply problematic. So that's one side. On the data usage side, so first of all, we are built to be global. So we meet the highest and best standards of data management. So we have a very robust and very secure system. Some of the biggest names in healthcare technology have torn us apart and tried to, crack our system, and we're routinely attacked all the time. And our system is very robust and very secure. That said, in Canada, for example, we ensure that all data is housed on Canadian servers. So no information goes to the United States at all, for example. So we have the flexibility to make sure that content is and information that lives on servers within that jurisdiction's framework. So we are fully compliant in that way. Patients also consent to the use of this information. The information that our company is collecting and what our technology is collecting is largely de-identified statistical information. So, we're not, for example, like our client, one of our keystone clients, like Shoppers Drug Mart, for example, they're collecting a lot more information. They have quite intimate information about you, right through to your, consumer behavior, right? So there's perhaps a bigger risk for those companies. For us, the way our system is built, that someone could potentially get some de-identified statistical information, so they would know, the statistical likelihood of a 38-year-old having, heart disease. So that's more of a commercial loss for us. However, it is a very serious concern, and so all those consents are provided within our system, and an individual at any time has the ability to opt out. So we are fully compliant as well, that an individual, if they want their information scrubbed from our system, that we would do that.
Okay, so Hector, that actually sounds great. I mean, about the de-identified and then looking at aggregate, but what about that interoperability with electronic health records? If people wanted to go down the road of personalized conveyance of your personalized data to your physician, how do you decipher between what's de-identified and what's identifiable for the patient? And how is that information? We hear a lot about edge computing and where that information resides versus getting shuttled off and encrypted into somebody else's systems. Does that still exist within within your health tab?
Within health tab, yeah. No, it's sort of inherent, because what we're connecting to is the programs, the systems that the healthcare practitioner is already using. So it's those consents, those additional consents, or I guess onuses are on the operators of those EMR systems, the electronic management record systems. So they have to ensure that they're meeting their own standards and their own standards of practice, and providing their own consents, etc. Within our system, is simply they are consenting that it is being shared with their healthcare practitioner, and that de-identified information could be shared for research purposes. However, again, a person can opt out of that at any particular time, but there's no personal information that we're sharing or monetizing or coming out of it. It's not. We don't even collect that interesting of information on that side of things. That what we're collecting is the diagnostics, the statistical information, like how bad is that person's HbA1c. So that's kind of it. And that information then goes into the healthcare practitioner or our partners' systems, which could be utilized to aggregate it with other information. So, like, for example, as in our work in connecting with HealthWatch, which is Shoppers Drug Mart's own EMR system. That's a very interesting system. It has a lot of interesting information about the patient, and they're using that to drive a future of better service to the patient. So to kind of close the thought, I'll paint you a picture again using the sort of Shoppers Loblaws model. If people have been watching, what they've been doing is that Shoppers was an acquisition of Loblaws, of course. Loblaws has subsequently acquired stakes in companies like Legion, which is now powering their PC Health app, which is a really smart program. And then on top of that, they have Maple, which is a telemedicine company. So you can see how companies are building an ecosystem of services in this health sphere. What's really interesting about the Loblaws models is it's also tied to diet in the long run, right? So you're in the future, not only will your consumer behavioral habits be used to sort of suggest a sell to an individual, but also your actual health status, for example, will be, for example, if they know that your cholesterol is too high, that you will then be steered towards products and services that will not exasperate that issue. Whereas an individual, if they were buying a lot of like junk food, the algorithm pretty much was to sell them more junk food, which was a negative approach. But I think that even today, my wife and I, we had groceries dropped off by Instacart, huge fans. Now that the grocery shopping experience is moving online, there's this really cool opportunity on the health side of things, because obviously diet is so related to health. So how do we start to connect these dots? So I think it's a really exciting time. I think people generally understand that, look, there's information about you on the internet. You can, I don't know, get a concrete bunker and start buying.
Yeah, it really is a question, honestly, Hector. Honestly, if people are uncomfortable with this, but it's a world of
right.
trade-offs, and that's a whole other conversation that has to happen.
Yeah.
I've got a couple more questions to ask before we close the session, but a couple of things is really understanding the business model. So you have a very interesting platform. There's some opportunity for testing, and you're really consolidating this increased scope of practice with pharmacies. The question comes down to is who ultimately is paying for the software? And then the second piece is what are they exactly paying for? And I'm thinking about all the myriad of people that you could potentially be targeting. I'm thinking about clinical research organizations, pharma companies. I'm thinking about payers. Tell us a little bit about how the business model works with HealthTab.
So we offer the platform to the pharmacy, and the pharmacy per location pays a fee to have the system on site. That's going to include analyzers, plus the software as a solution and the connectivity. And so we also provide, a certain level of clinical advice, and we also provide some marketing support in terms of how to communicate it. In terms of who pays, I'll start off by saying that we strongly advocate that the patient does not pay, particularly for the endemic disease testing, like the blood chemistry test. There's more of a function as in Canada, there's not so much a consumer habit on that. In the United States, it might work, but not so much in Canada. And the reason why we feel that way is that the pharmacy has their own drivers and their own ways of actualizing revenue from having the platform. So they can already get remunerated for conducting certain consultations through public healthcare or private healthcare. There's also the opportunity for patient acquisition. The patient acquisition aspect of this is extremely high for them, and it's a low-cost way of them earning the business of that prescriber. There's also, just the foot traffic aspect of it. So for all those reasons, we say don't charge the patient for that. On the virological side, we think obviously there's a patient pay model to be had there, and that's being developed as we speak. But the most interesting component becomes, and it's sort of using the, currently around $75 billion a year US spent on clinical research, taking those dollars and using that to drive more early detection and screening by the virtue of the fact that the network itself is sponsorable. So sponsored programs, blinded, of course, are able to run on our network, and that the target patient demographics can be sought within the pharmacy itself. So the pharmacist just knows that we're seeking out women, 25 to 55 in experiencing XYZ issue, and so that they're now being targeted in that approach to say, come in, get tested. So the patient is winning. To that point around the trade-off is that you're getting this enhanced service. Your information is not being used to drive you towards extremist politics or buy another I don't know, buy another car you don't need. But the point is that this information is primarily being used to drive improved efficacy of drugs, conduct lower cost research, and get drugs to market faster. And this is something already mandated by the FDA and the CE, that the current model of clinical trials is clearly broken. It takes about 10 years and about 2.8 billion in capex to get a drug to market. That's too long to get the product to market. The patients are having worse health outcomes because of that, and it's too expensive. So the pharmacy is the best place to conduct this type of research. And so we're looking forward, and we've already had an enormous amount of interest in using our platform to study real world populations and get products to market faster at lower costs.
Yeah, so it sounds like a great model, like you were saying. It's also very interesting that you have niche, because a lot of people haven't targeted pharmacists, but providing them with the tools. And so they're great opportunities for recruitment of patients into clinical trials. And again, a much more democratized way, so much more inclusionary of more underserved and underprivileged areas. But I think it's also interesting of potentially looking at this as a subscription model for a continuous data delivery to manufacturers. So I think there's a lot of really interesting business model there. My last question, really to close up the session here, Hector, is really about the, I guess, rumination about what the future could look like. We're hearing a lot again about the acceleration of telehealth, telemedicine, use of wearables, decentralized trials, and the list goes on. COVID has really been an accelerant of this inevitable changes. Now we're actually thinking about the bricks and mortar pharmacy, pharmacists sitting behind a counter and dispensing real life pills. What is the future of Health Tab, the future of pharmacy as it relates to the digital space, looking at things like even like 3D printing of medications and being able to start dispensing of coaching and consultation in a more digital way? What does that look like for your company?
Well, for us, and I've touched on it already, is we think that services is the future of pharmacy, that with central fill and just the overall pressures on pharmacy from a bunch of different, a quick example would be like Walmart shrinking general merchandise to add the Jack Nathan Health clinics to their facility. So, beyond the fact that online retail and service delivery from the medication side of things is taking away brick and mortar business. There's also the other pressures of just needing foot traffic that have nothing to do with pharmacies, more the retail aspect. So services on site is key. And so that's why we're trying to power them in that new revenue model, in that new world, by providing them the technology they need. But you mentioned telemedicine, and I was having this conversation with somebody earlier today, and I like in British Columbia, we've had Babylon out here for a while from TELUS Health, and I've used it. The only challenge with it is that the physician is not laying hands on you, not physically with you, right? So it's a problem for them in terms of their own professional standards and scope of practice, is that there's actually limited to what they can really do. Like, they can talk to you and they can maybe give you some advice, but there's very limited as to what they can do. They still need some sort of diagnostics. Now, there's some interesting companies that are doing, for example, like you have a telemedicine appointment, but a nurse is basically going to come to your house or meet you somewhere, and they're going to have like a bag of diagnostics tools, and they're basically going to be conducting diagnostics with you that the physician will see. That's one way of doing it. But we think that actually the most sustainable way of doing it is within the pharmacy. The pharmacy already is working hand in glove with the physician. And I sort of described earlier, like the Loblaws approach, which we think is quite smart, is that they invested in telemedicine and they invested in pharmacy. And so now they're kind of merging these things together, and everything in between, from dietary support, mental health support, all the rest of it can all be conducted but in a continuous flow, and a lot of that being online. However, the touchstone remains the pharmacy. And the pharmacy is still the place where you can still talk to a human, someone's still seeing you, and that diagnostics equation is driving this as beyond certain just an ephemeral conversation, but this is actual, data driven in it, and it's it's much more concrete, I guess, is the phraseology. So that's where we see pharmacy going. I think that, what's really exciting about pharmacy is that, 4,000 years ago, you could walk into essentially a pharmacist, and the business is it's changed a lot, I guess, but it's more or less always kind of been the same things where you picked up medicine. And, they've operated the same way for a lot of years, but, this is this exciting opportunity for them to sort of be Uberized or Airbnb'd in the sense that, you have these established sectors, and then, the buzzword or the cliche is disrupted, but it truly is in a process of major disruption. A lot of it is external influences, but, technology has opened the door for them. And I would close the thought by saying that COVID has really not only reintroduce them to their patient and the general public, but government as well. I think there's an enormous amount of goodwill built and positive equity built with government right now. The immunization programs were so successful, and the amount of service that pharmacy was able to and slack the pharmacy was able to pick up during the pandemic has proven that they do deserve that scope of practice change. So with scope of practice change, technology change, and more collaboration with digital health tools, we think that the pharmacy is a really, really exciting space.
That's awesome. And I actually just spoke with somebody not that long ago from places like Best Buy Health, where you actually can start working in consultation with like things like geek squads. And, we know that the home will become the new point of care and the new hospital in the future. But anyway, the conversation will continue. Thank you so much for this. This is a great conversation. We want to thank everybody who's been listening or watching. Anybody who's interested in connecting with Hector, partnership, finding out how to actually get in, looking at some subscription model or anything in between, we will be leaving his contact information in the show notes below. So please be on the lookout for this on LinkedIn and afterwards. If anybody enjoyed this show, or, we actually encourage you to check out impetusdigital.com. These are the exact kind of conversations we have with pharmacists, payers, patients, allied healthcare providers, physicians, putting together and working with manufacturers and other interested healthcare stakeholders to move ideas and agendas forward through a series of asynchronous and synchronous touch points. And Impetus helps you along the way to get those deliverables, those ideas moving forward. So check out our website. Please like and subscribe to our channel. And we would love if you can leave us a testimonial on iTunes as well. Thanks for everybody for your time. Hector, this was a fantastic conversation, and wishing everybody a wonderful day ahead.